So for the next radial nerve injury would be the pin syndrome or the posterior interosseous nerve injury, wherein it is a neuropathic compression of the posterior interosseous nerve where it passes through the radial canal. So before we start our examination, we always have to ask for consent before we touch the patient's body. So for inspection, we will be doing ocular inspection on the posterior forearm of the patient. So upon ocular inspection, we can see that there would be swelling and inflammation on the posterior forearm. Moving on to palpation, using our two fingers, ato palpate ang posterior forearm of the patient and we'll be asking series of questions. So I'll now be touching the posterior forearm of the patient. So ma'am, when I touch you here, ma'am, do you feel any pain, ma'am? Naka-feel kag pain. So what type of pain do you think man imong ma-feel, ma'am? Marshall pins and needles, the type of pain. So from 0 to 10, ma'am, 0 being no pain at all and 10 being the worst pain possible, pila man imo i-rate, ma'am? Okay, so grabe jud siya kasakit, ma'am, no? So with that, ma'am, unsa man na motion or action na maka-aggravate sa iyang pain man, ma'am? So when you try to face ang imong palm upwards or sa ceiling, so what is siya for inspection and palpation? Now we'll be doing the musculoskeletal assessment starting with the range of motion. So for the range of motion, we'll be first testing the supination. So for the passive ROM, will be doing what would be the therapist would be doing would be that the hand should be on the side and then ang palm will be facing inward. So in addition position, and then the therapist will hold the elbow on the, here's the elbow, and then the other hand of the therapist would hold the forearm and iya supinate or pa-face upwards ang iyang palm sa patient. So that would be PROM. So basically paana sa therapist. So now we'll be doing the active range of motion. So we have here a goniometer, and then the positioning of this would be that the stationary arm would be parallel to the anterior midline of the humerus, the fulcrum would be on the medial and proximal to the ulnar styloid process, and this moving arm would be across the ventral forearm just proximal and parallel to the styloid process. So arms at the side facing inward ang palm, and then yan. So as we try na ipa-face up ang palm ni patient, kaya ato sa i-move ang moving arm sa ato ang goniometer. So it would be like this, which will give us na inani ang position sa iyang supination. So that would be for supination. I will now go to finger extension. So now we have finger extension. So for the finger extension, patient will be in a sitting position with a flat surface na nakastabilize sa iyang forearm. So with that, for the PROM, the therapist will stabilize here sa iyang thumb area, here, and then while stabilizing, passively extend ni therapist ang iyang mga fingers. So, and then we'll now move on to the active ROM. So for the ROM, we have here a goniometer, and then the positioning would be that ang proximal arm, this one, would be dorsal to the metacarpal. The fulcrum would be the dorsal aspect of the MCP joint, and the distal arm would be dorsal midline of the proximal phalanx. So ano siya? So nanay siya nag-stabilize here like that. And as pagkuha na to ni patient na ipa-extend ang iyang finger, kaya ato sa i-move ang atong moving arm. So extend until such time na okay na. So mo give ta na mo ni ang finger extension sa patient. We will now be doing the wrist extension. So the patient will be in a sitting position, and then the forearm would be on a pronated. So example, mo na nakapronate na iyang forearm. So what would happen would be that the therapist will stabilize the forearm, and then passively extend ang wrist sa patient. So what will happen is that mo stabilize here, and then the therapist will passively extend the forearm. So stabilize here and passively extend. So that would be for the PROM. For the ROM, we have a goniometer. So with the goniometer, the stationary arm would be lateral to the ulna. The fulcrum would be on the lateral aspect of the wrist over the trichotrum, and the moving arm would be along the lateral midline of the fifth metacarpal. So ano siya? And then alam na siya, and then ipa-extend na to ang wrist sa patient, and then measure. So this would give us na inani ang wrist extension sa atong patient. So for the last range of motion natin, test would be the ulnar deviation. So as for PROM, patient will be in a sitting position and then naka-prone with a support on the forearm. So imagine na visual set na nag-support here. For PROM, the therapist will stabilize the forearm and then ipa-move niya to kung asa ang side sa to ang pinky. So like that, paani. So like that. So that would be the PROM. So stabilize here and then move here. Like that. So for the active ROM, we have your goniometer, and then same gapo naka-pronate, and then nag-support sa iyang forearm, and then the stationary arm would be dorsal midline of the forearm, the fulcrum would be dorsal aspect of the wrist over the capitate, so here, and the moving arm would be along the dorsal midline of the third metacarpal, so along sa inline siya sa ato ang middle finger. So with that, ato ulnar deviate, and then measure until such time na maka-achieve ta og yan yung position sa ato ang ulnar deviation. So for the next assessment under the musculoskeletal assessment will be the MMT, or our manual muscle testing. So for the first MMT that we'll be doing would be the forearm supination na test muscle strength. So under the forearm supinators would be the supinator muscle and your biceps brachii. So to test for the forearm supination, the patient will be in a sitting position, and then forearm will be in a 90 degrees flexion, and then the forearm would be pronated, or the palms will be facing downwards or to the floor, or in any naka-position, so like this. And then the therapist will be beside the patient or in front of the patient, since part of the testing for grades 5 and 4 would involve resistance. So mo add og resistance sa iyang pagdo sa supination. Tana. So for grade 3 there will be no resistance applied. So with that, the the therapist will now instruct the patient na, ma'am or sir, I want you to face your palm to the ceiling. So basically, flip ni patient ang iyang forearm upwards. So like this. That's for grade 3. But for grades 5 and 4, if kaya to ni patient, pwede siya mo-increase to 5 and 4, then add og resistance. But if dili kaya na ang grade 3, mo na sa lower, which is ang grade 2 to grade 0. So for the next MMT that we'll be testing would be for the finger extensors. So the muscles under your finger extensors would be your extensor digitorium, your extensor indicis, and your extensor digiti minimi. So with that, the patient will be in a sitting position. So the forearm should be in pronation or the palms will be facing the floor, and then the wrist should be in neutral. So in neutral imong wrist, but your MP and your IP joints are in relaxed flex posture, so like this. So the testing grade that we'll be doing first would be grade 3. So no resistance. Mo-apply og resistance na ang therapist would be grades 5 and 4, and then wala na sa ang 2 to 0. So with that, the therapist will be either in front of the patient or beside the patient. So mas better na nasa side, so makastabilize since the therapist will apply stabilization here sa wrist. So with that, instruct the patient to bend your knuckles back as far as they will go. So as far as they will go. And then you observe what will happen, and then if kaya na ni patient, we'll be testing further for grades 4 and 5 or mo go ta lower to 2 to 0. So that's it for your finger extensors. So for the last MMT that we'll be doing would be your wrist extensors. So the muscles under your wrist extensors would be your extensor carpi radialis longus, extensor carpi radialis brevis, and your extensor carpi ulnaris. So the tested position would be the patient would be in a short sitting, the elbow would be flexed, and then the forearm should be pronated or naka-face down the floor ang iyang palms, and then there would be a table that would be supporting the forearm. So in a nation position, and imagine na table here. So the starting grade nato test would be grade 3, and there would be no resistance. But for grades 5 and 4, there would be resistance applied. So the therapist will be sitting or standing diagonally towards the patient, since the therapist will apply stabilization or support sa iyang wrist area or near sa iyang forearm na. So with that, the therapist will now apply stabilization here, and then the PT will now instruct the patient, since we'll be testing for grade 3 na, bring your wrist up. So bring your wrist up. So this is applicable for grade 3. But if for grades 5 and 4, the stabilize here, and then you'll be instructing the patient that bring your wrist up and don't let me pull you down. So wrist up, so apply here like that. So that would be your grades 5 and 4. So for the last assessment under the musculoskeletal assessment will be your muscle bulk test. So to test for your MBT, we'll be testing both sides. We'll be starting with the good side first. So with that, the patient will be in either standing or sitting position, and then naka-flex ang iyang elbow, and then pronated ang iyang forearm or the palms will be facing downwards, and then ipa-contract ang iyang forearm, so ipana. And then with that, when naka-contract, the therapist will now apply mo touch or mo palpate for the highest bulk sa iyang forearm. So with that, naka-contract na, so mo palpate ang therapist here. So mo na ni iyang highest bulk na muscle, and then using a tape measure, i-measure ang katong circumference of the forearm sa katong asa padapit ang highest bulk. So mo ni sa good side, and then for the bad side, same thing gihapon na the therapist will naka-flex, and then ipa-contract, then palpate or touch for the highest bulk, and then measure with a tape measure for the circumference of the katong area na dito ang highest bulk, and then kung with that, compare the measurement of the good side and the bad side, and then if na difference of 1.5, there would be atrophy found na sa iyang muscle sa iyang kung asa to ang naay dako na difference. So now we'll now proceed to the functional assessment using the ATDEP, wherein patient will have an decreased functional independence as to eating, dressing, and personal hygiene. Next is we have the functional assessment using the ATDEP, wherein the patient will present a decrease in functional independence as to eating, dressing of the upper extremity, and as well as personal hygiene. So with that, we'll now move on to special tests. So for special tests, there will be 2, wherein will be incorporated during your ROM and your palpation. So for your first special test, we have the wrist extension, wherein will manifest a radial deviation upon performing the wrist extension, and there will be increased pain felt when there is resisted supination. So lastly, we have the outcome measure, which is the dash or your disability of the arm, shoulder, and your hand. So with that, it is a 30-item self-report questionnaire and will be given to the patient, and then ilay answer to see if at what level or at what point na sila the disability ilahang low upper extremity.
So for the problem list under the pin syndrome, we have a pain on the posterior forearm, swelling and inflammation on the posterior forearm, loss of motion on supination, finger extension, wrist extension, and ulnar deviation, decreased muscle strength on supinators, finger extensors, and your wrist extensors. And lastly, there would be a decreased ADLs as to eating, dressing, and personal hygiene.
Moving on with our plan of care, we'll be starting off with patient education about PIN syndrome, the possible complications, and the prognosis of the condition. Next would be the hot Mars pack in sitting position on the posterior forearm for 15 minutes. This is to reduce the pain and in preparation for therapeutic exercises. Next for this would be deep tissue massage to the forearm musculature in sitting position for 5 minutes to be able to improve muscle extensibility and to increase blood flow in preparation for ROM and strengthening exercises. Arm exercises, this is to help improve joint mobility, and we'll be doing this for 6 repetitions and 2 sets. So for the first arm exercises, we'll be doing wrist extension, where inpatient will be in sitting position, and then the therapist will be on the side of the patient or in front, and then patient will now do wrist extension first. So wrist extension, we'll be doing this for 6 repetitions and 2 sets. Next would be ulnar deviation, radial deviation, ulnar, radial. And then for the last RM exercises would be the pronation and supination. So pronation, supination, pronation, supination, and all the RM exercises again will be done 6 repetitions in 2 sets. Next would be the RM exercise for the strengthening. We'll be doing the same RM exercises, but we'll now be using weights. This is to help improve our muscle strength, and we'll be doing this for 6 repetitions in 2 sets. So just like with the RM exercises that we did a while ago, we'll now be doing it but now weight. So wrist extension. So example, this is the 1.5 kilogram na weight, and we'll be doing wrist extension, ulnar deviation, radial deviation, ulnar deviation, radial deviation, and then pronation, supination, pronation, supination, and again this will be done 6 repetitions and 2 sets. So for the next nato na exercises will be the radial nerve glide. So this is to reduce the intraneural adhesion and assist in the modulation of the neural system, and we'll be doing this for 5 repetitions only. This is to avoid any irritation on our radial nerve. So for the first exercise under the radial nerve, we'll only be doing 2 para to avoid the irritation. So the first thing that we'll be doing is that we'll be doing this in a sitting position, but tapos ang sa tong shoulder kay slightly away siya sa body, slightly away. So imagine if naka-sit down ko, so slightly away and then slightly pa backward. With that, kaya ang ato ang wrist kaya ato i-bend siya palayo na to. So murag natigi throw. Sa layo. So with that, so sitting na tanong, so we'll be doing this in and out. So in, ay out, in. Like that until maka-feel tag na magnay glide sa atong nerve, and we'll only be doing this for 5 repetition. So for the next one will be the same position, nakaana, but instead na inani ang position pa inward. So like this. And then as simultaneously siya na while doing this kay mo pagawas. And then so kani siya while inani ang position sa atong hand, the position of our head would be sa neutral or inani na to na level. But when we do like this na position, mo rotate ang ato ang head to the opposite direction, which is here to ang left side. So ani rotate that, rotate. And we'll be doing that for 5 repetitions to avoid any irritation sa ato ang radial nerve. So for the last intervention that we'll be doing would be the task-specific functional activities. This is to facilitate functional independence for 10 repetitions and 3 sets. So for this exercise, we'll be using different shapes of objects like inani. You also have like this. You also have ball pens. This would, while performing mga motions of pronation, supination, wrist flexion, extension, your ulnar deviation, and your radial deviation. So we'll be doing this for 10 repetitions. So example, we'll be using this shape. So we'll be doing this for 10. All the different motions we'll be doing for 10 repetitions and 3 sets. So for this shape, pronation, supination, wrist flexion, wrist extension, your ulnar deviation, and your radial deviation. So the purpose of doing this exercise, this is to facilitate katong mga impaired na ADLs niya, which is the eating, the adjusting of the upper extremity, and as well as personal hygiene.